Good morning, esteemed members of the committee. My name is Anna Shroeder. I've been a registered nurse for nearly 10 years. I spent 7 years working in critical care, and I now work as an infection control nurse. I'm here today to speak in favor of Senate Joint Memorial 8004 and to advocate for universal health care in the United States. I've seen firsthand the devastating consequences of inadequate access to health care. One patient, a homeless man, lost his leg to gangrene because he couldn't access necessary medical care. After his recovery, he was discharged back to the streets due to a lack of suitable placement options. My ICU specialty was stroke nursing. I've lost the count of the number of patients I've treated for stroke directly related to quote unquote non-compliance with medicines that they could not afford, the very medicines that would have prevented the strokes that had now left them paralyzed or unable to speak. These tragic outcomes could have been prevented with a more equitable healthcare system. Implementing universal healthcare in the United States would reduce the financial burden on families by making healthcare expenses predictable, allowing them to prioritize their health without fear of crippling debt. It would support our physicians from primary care to specialty surgeons and reduce burnout, leading to better chronic disease management, fewer medical errors, and reduce load on our already overburdened healthcare system. It would also reduce the administrative workload for healthcare providers, allowing them to focus on patient care rather than battling insurance companies for necessary treatments. Why demand years of sacrifice and training from our medical professionals and then question every decision that they make? It would prevent the closure of critical access in rural hospitals, ensuring that all Americans have access to care no matter where they live, and it would eliminate the profit motive in healthcare, focusing instead on improving quality of life. Let me repeat, no one should be profiting off of the suffering and illness of the American people. All capital from a healthcare system should be returned to the system for facility improvements, research, and staff compensation. Senate Joint Memorial 8004 clearly outlines the need for universal healthcare, the efficiency, cost savings, and improved healthcare outcomes seen in other countries. Despite what the opposition has claimed, wait times in countries with universal healthcare are shorter in America, cost per year per citizen is less, and health outcomes are better across all demographics. This has been well documented in reports by the CDC, NIH, WHO, and the UN. It goes beyond the monetary concerns, however. We have a moral imperative to care for each other. If we do this, and we cannot get the federal government to agree, we know that in Washington state, we are leaders in information technology and medicine and are well positioned to serve as a prototype for a successful universal healthcare system in the United States. The only things holding us back from a healthier future are fear of change or pressure from those who are personally benefiting from maintaining the status quo. And it's time to put aside our fear and do what is right and just. Thank you.
Want to have universal health care? Check us out at wholewashington.org.